finalizing the preparation so that we can begin the tendering of the contracts, and construction will begin as soon as possible. And we are targeting 2015 to complete the construction. A project of this size that incorporates the latest technology and will meet the challenging healthcare needs of a community is very complicated and requires a significant amount of time of detailed project planning. And we made sure that we took the time needed to get it right. While this has resulted in some short-term delays, residents of High Prairie and surrounding communities will be the long-term benefactors of that wait. Minister Horn talked about a bigger and better modern healthcare complex that will provide the healthcare services that are needed. We'll improve access to the healthcare system and are based on local needs. A project like this is required to meet the expanding needs as your community and population grows. A lot of the activity will be occurring over the next couple months, will not be that visible in the local community. Planning will be completed to cover the full scope and expansion of the project. I cannot stress enough how important this part of the process is. By year's end, we'll start the tendering process for the project scoping and construction. By early spring, major construction activity will begin, the construction of the foundation and site services, and that activity will continue into early summer. At that time, site development and construction of the superstructure, which is construction above the ground, will start to appear. Building bigger also means increased cost. I want to stress to you that we looked at where we could trim costs without affecting patient care. Now that the functional plan has been completed and the scope of the project has been expanded to meet the needs of the community for many years to come, we are investing an additional $70 million into this project. I guess everybody's going to tell you that. So the total cost of the High Prairie Health Complex now stands at $160 million.
Wow.
That's a lot of money, especially in the time of global economic uncertainty. The additional funding that was needed came from existing budgets. Actually, some come from the South Calgary complex, so there was some money left from Africa, so we took some from there as well. So we've done it all in budget. We haven't gone over budget. We're taking it from different projects. So I also want to emphasize that while we've increased the size and funding for this project, we've been extremely careful to ensure that we're getting full value for taxpayers' dollars. While we continue to meet the needs of residents from High Prairie and surrounding communities, while building a quality healthcare center is important, it's what goes inside that counts the most. You know, that our friends and family members will receive the care and services that they need. Today's announcement is about meeting that need and is also a very strong commitment to preparing for the future of High Prairie. Over the next 3 years, I encourage you to watch the new High Prairie Health Complex grow and take shape. And I look forward to seeing all of you again when we celebrate the official opening and ribbon cutting.
Oh, yeah.
That was a good day in 2016. You know, infrastructure can build the building. That's, you know, takes a while to get the plans and the dollars, but now we can go ahead and build it fairly quick. But that's just the bricks and mortars. It's the healthcare system and the community that will really make this a hospital for the community. So congratulations, and we look forward to great progress in the near future.
Thank you very much. And I was telling them, I said, you know what, I'm just so sick and tired of having so many darn shovels. I don't want to be doing any more groundbreaking. So as a result, I think we just make sure that it was announced and that we do the work that needs to be done, and I don't want any more shovels, and so until we cut the ribbon, and I don't mind a ribbon, so and I know that we'll see that ribbon. As was noted, the planners consulted with physicians and other hospital staff. These are the people who know what the people of this region need in a hospital, and they know what that hospital needs to function efficiently and effectively. So today I'm very pleased to have with us Dr. Kevin Worry, who's been here sort of listening to everybody as you waited. The Zone Medical Director at Alberta Health Services. Tell us more about what that means. Dr. Worry, please give him a warm welcome.
Thanks, Pearl. Certainly for Alberta Health Services, we're extremely pleased with today's announcement. This is a project that's been very important to our physicians, and we have Dr. Robert Laughlin as our Community Medical Director who's with us. He's even at the front here today. We have Olive here as one of our acute care managers, and I apologize that Roxanne, she would feel really bad, but she's on vacation. She would have loved to have been here, because I know she's put her heart and soul in advancing this project as well. And a number, we've got Cindy Harmatters, our director, a number of our care providers are here. This is even more important to the patients in this community and to all of its community members. We're absolutely committed to providing the best quality of health care that's out there, and the vision that we have for the new High Prairie Health Complex is absolutely consistent with that vision. Much of our discussion to date so far has really looked at some of the bricks and mortar. With the approval of our functional programming, we get to move beyond that into really how we take cutting-edge technology, how we take cutting-edge healthcare delivery, and bringing that to High Prairie. I'd like to take just a short little moment to really thank Minister Horn for taking the time right from the beginning of this project to be willing to say, okay, are we doing the right thing? Are we replicating what's happened in a traditional acute care-based hospital model, where there's a lot of emphasis just that on acute care, and in sitting back and in really setting a vision that was based far more on a continuity of care, right from birth all the way through to geriatrics and continuing care, making sure that if somebody needed care in the community, intermittently needed acute care, and then back to the community, that there was going to be an integrated pattern of healthcare delivery, and that what we were building was going to meet that care all the way along. And that's fun, like as a physician who's been doing this for 15 years, that's fundamentally different than the vision we've seen in healthcare previously. So when we look at full interprofessional teams in one location, now Robin and his docs, you guys are used to having your physicians in a hospital, and having the clinics in the hospital. That's different than a lot of our other northern communities. In being able to bring full interprofessional teams in, so you're looking at social workers, physio, when you're looking at addiction and mental health, all of the other sport workers, the nurses, your LPNs for chronic disease management, all in one location, so that when a patient can come in, and again, you're either emergent, non-emergent, and receive that care in one place and across extended hours, it provides a fantastic level of service that we haven't typically seen before. And again, I really appreciate the time and effort that Minister Horn and Minister Drysdale put in, along with Pearl and a number of other MLAs, and making sure that we stay fast to that commitment, even though it has taken a little longer. Certainly, one of the other things that we're looking forward to is the advancement in continuing care. There has typically in the past been a fair amount of emphasis on long-term care, and we do need long-term care, but we also need to make sure that we advance home care so that people are able to stay at home as long as possible with the supports they need. We need to make sure that if somebody needs a little more help, like supportive living, that they have that, and that we have the spaces available to support that rather than necessarily always moving to long-term care. And so making sure that the continuing care facilities that are built are going to go ahead and meet the needs of the community on that ongoing basis is a major step forward as well. As we look through the different parts of the new hospital, whether you're looking at the emergency department, whether you're looking at the endoscopy suite, whether you're looking at surgical services and really looking at the hub and spoke model that we have for the North Zone, of bringing more specialty services closer to home. So the plans in balancing out having a general surgeon, obstetrics, anesthesiology, and balancing across a number of different communities. So we move past the vision of one specialist in one community and really look at communities can work together to make sure that we can attract the sort of specialists that want to stay longer term and that can really develop themselves into the fabric of a community and stay longer term. So we have that consistent specialist healthcare delivery over a longer term basis. We're really excited with the vision that this infrastructure, that this new health complex will provide to house such a development. One of the things that I need to highlight at the end here is it has certainly been a treat for me to have as much community involvement as we've seen in High Prairie, because we don't always get that in every single community. When I was talking to Ken on the phone last night, I mean, the number of phone calls I've had with Ken about this, the number of phone calls with George previously as our HAC chairs, it has really been a treat for me to go ahead and have as much advocacy, as many people saying, hey, this is really what our needs are, and how can we be actively involved in helping to design the healthcare delivery in our